There are two sets of systemic veins. They all carry deoxygenated blood towards the right atrium and then eventually into the right atrium. But one set are deep veins. So deep veins are deeper in the tissue and run parallel to the arteries. So if there's a brachial artery, it makes sense that the vein running parallel to it is called the brachial vein. So usually the systemic veins are named the same as the artery that they lie next to. In some cases there's a different name, but most of the time the veins are named the same as the artery. The second set of veins are called superficial veins, and that's because they're lying just beneath the skin, so they're more superficial, and they're not paired with an artery. So for the superficial veins, we need to come up with other names. We're going to learn 6 of these superficial veins. They're the bigger ones, but there's a lot of other smaller superficial veins. As far as blood flow, they do the same. Their job is to bring blood back to the right atrium, but they have an additional function in helping to cool the body. So if you can run more blood just beneath the skin, you can remove more heat from that blood. So a lot of times when we are very hot, these superficial veins will dilate so we can send more blood just beneath the skin. So again, for the most part, when you learn your arteries, you want to think of blood going the other direction in a vein. So when you learn veins, you want to do it by blood flow. So when we learn these veins, we're not going up the head and neck, we're coming back down from the head and neck. So we're going to start with the brain. So in this skull, there's a brain. The deoxygenated blood is collected in what's known as dural venous sinuses. So these are veins, but they don't have all the properties of a vein, and they act more like kind of a cavity that collects the deoxygenated blood. So they're known as sinuses. And these sinuses are found within the dura mater. If you remember dura mater being that outer layer of your meninges, that's where this blood is collected. So the deoxygenated blood gets collected in the dural venous sinuses and then drains out of the brain. The blood from outside the brain goes into the external jugular vein. So that's this guy right here. And then that blood, most of that blood from the dural venous sinuses will drain into the internal jugular vein. So notice this is an example where the veins are not named the same as the arteries. The arteries in your neck are carotid arteries. These are jugular veins. But if you follow the blood flow down, this external jugular vein, the internal jugular vein, the subclavian vein, which is bringing the blood from that arm, are all going to merge together into what's called the brachiocephalic vein. And there is 2 of those. So where there was only one brachiocephalic trunk on the artery side, there's 2 brachiocephalic veins, and they're going to merge together to form the superior vena cava. And then that superior vena cava brings the blood into the right atrium. All right, so we just drained deoxygenated blood from the head, the neck. We saw where it's going to eventually go from this right arm, and we all bring that blood into that superior vena cava. So when we study an arm, the veins of an arm, we do the same thing. We start at the hand and work our way towards eventually the subclavian vein. So we know we got to get this blood from the arm into that subclavian vein so it can go brachiocephalic vein and then superior vena cava. And here, shown in black, are all the deep veins. So these should look familiar. So you've got radial veins, and notice a lot of the deep veins come in pairs. So there's not just one radial vein, there's 2, and then they have these little connections. These little connections are anastomoses. All right, a lot of veins have these little vein-to-vein connections. So there are the radial veins. There are the ulnar veins. They all kind of merge together to form the brachial veins, and then eventually lead to the axillary vein, and then the subclavian vein. So that's just reversing the order when you compare it to the arteries. So those are the deep veins. Now we're going to add 4 superficial veins. The first one I like to talk about is the cephalic vein. So that's a bit confusing. Cephalic, you should think the head, but this vein really has nothing to do with the head. It was not really named properly, and I tried to find out exactly why, and there's a couple theories out there. One theory is it was just translated wrong from one language to another. Another theory out there is maybe they thought the blood was going towards the head, but it really doesn't. But this cephalic vein is the most lateral superficial vein. So if you think of your directional terminology, this is the lateral side, this is the medial side. So the cephalic vein comes up the lateral side, all right, kind of comes up along the thumb side. There it is here, and then it goes all the way up. Sometimes you can see it in someone's shoulder up here, because again, it's superficial. It lies just beneath the skin, and then it dumps in just about at that axillary vein. Then we go over to the medial side, and we find a superficial vein called the basilic vein. And I looked up basilic, it means royal vein. I could never really figure out why they called it royal vein, but that's the basilic vein. So you got one on the lateral side, one on the medial side, and then you have 2 in the middle. And when we have something that's in the middle, we call it median. So this one is in the middle of the forearm, so it's called the median antebrachial vein. Antebrachium is your forearm. So this one goes up the middle of your forearm. And then the cubital region is this area here, and that's called the median cubital. And it basically crosses over from the cephalic vein over to the basilic vein. All right, so these are the 4 superficial veins of the arm. These are all utilized to draw blood. So when you draw blood, you'd much rather use a superficial vein than a deep vein, so the needle doesn't have to penetrate as far into the tissues. This is just a real picture of someone's arm. No, it's not my arm. But you can see clearly that these veins are lying just beneath the skin, all right, and this is the superficial vein called the cephalic vein going up here. The basilic vein you can kind of see here, all right, running up here and then up that inside of the arm. Here's the median antebrachial vein in the middle of the forearm. And then here's that median cubital vein. So just giving you another idea of why these are called superficial veins, because they lie just beneath the skin. Okay, so let's look at the veins of the abdomen. So this shows both veins and arteries. We can see that abdominal aorta and the common iliac arteries there, but we're looking at the veins. So we can see the veins, coming from the legs are going to eventually go into an external iliac vein, and then common iliac vein, and then the 2 iliac veins are going to merge together to form the inferior vena cava, which brings that blood up eventually to the right atrium. All right. Kidneys have renal veins, so you got your renal veins there. We see a couple gonadal veins coming up from the gonads. We've got some hepatic veins, which come from your liver, which we'll talk more about the liver in a moment. So a lot of the veins of the abdomen are similarly named as the arteries. This is a special circulation. So this is kind of, we're adding to these veins a little bit. And what this is a detour. So sometimes blood, instead of going directly back to the right atrium, like it did from the head and neck, like it did from an arm, it takes a detour. All right, so when you take a detour, that's called a portal. All right, so this is called the hepatic portal circulation. What we're doing here is we're taking the blood from the intestines, from the large intestine here, from the small intestine here, from the spleen over here, and instead of going directly back to the right atrium, that blood is going to flow into the liver first. All right, so the liver is a detour. All right, so the reason we have to think about what's in this blood. So this blood isn't like the blood leaving an arm or a leg or a head where it's deoxygenated and it has waste and it lacks nutrients. This blood actually has a lot of nutrients, right? Because where does the nutrients enter? Well, it enters at your intestines, right? So you're going to be absorbing in nutrients from your foods all along the small and large intestines. And these nutrients could be way too high to be sending out everywhere. So we might need to store some of these nutrients. The foods you eat might have toxins. So the liver is going to protect the rest of the body from these toxins. So we can't just send this blood everywhere, right? Because once you get to the right atrium, it's going to be pumped to the lungs, pick up oxygen, and then eventually pumped everywhere. So you got to send this blood that is rich in nutrients to the liver. All right, so you got to use what's called the hepatic portal vein. So you'll notice we've got superior and inferior mesenteric veins. Right, superior comes from the upper parts of your GI tract. Inferior comes from the lower parts of your GI tract. We have the splenic vein, which comes from the spleen. Now, the spleen isn't absorbing nutrients, but what it is having produced is bilirubin, right? So when that spleen is removing red blood cells, there's that bilirubin to deal with, right? Remember, bilirubin you can't reuse, you got to excrete it. And we excrete it in bile. So you got to have a way to send all this bilirubin over to the liver, so then the liver can put it in bile, which goes into the gallbladder, and then it eventually goes into your intestines. So that's why the spleen is part of this portal system. But notice if you follow all of these three veins, that blood eventually enters this vein here called the hepatic portal. And that brings it into the liver, and then the liver does its thing with that blood. So what is that thing? Well, it's going to store any nutrients. So again, maybe you have a lot of glucose because you ate a birthday cake. You don't want all that glucose to go systemically. So you're going to store it as glycogen. Glycogen is a stored form of glucose. You might have to modify the nutrient in some way. So a lot of our amino acids have to be modified before we can utilize them. So the liver is going to modify nutrients. It can detoxify. So that's a really important function of your liver. So if you have any toxins in your foods, or maybe you have toxic chemicals, alcohol is toxic. Maybe you have other drugs or medications. So the liver can metabolize those, all right, before they have a chance to go systemically. We also learned that certain medications can't be given orally because they go to the liver. All right, so if you're ingesting a medication and it gets absorbed into your intestines and then goes into this blood, we need to know what the liver is going to do with that medication. So an example is nitroglycerin. Nitroglycerin is a very strong vasodilator. It opens up arteries. So you can give it if someone's experiencing a heart attack. So if you give it kind of as an emergency treatment and it can get to those coronary arteries, they can open up, all right, and get bigger and be better at supplying the heart with blood. But if you gave it orally and the person swallowed it, the liver completely metabolizes it, so it would never get to the coronary arteries. So nitroglycerin is typically given under the tongue, and it absorbs directly into that blood, which can get to the heart directly. We also learned that we can make drugs in what's called a prodrug form, kind of an inactive medication, but then when it goes to the liver, it can get activated, all right, based on knowing what the liver is going to do. So a good example there is codeine. Codeine is a painkiller, and when it's ingested, so you ingest codeine in a pill, it gets into the portal blood, goes to the liver. Well, the liver modifies it, and it gets converted into morphine. So now you've got the active drug called morphine, which is a pretty strong analgesic or pain reliever. All right, so this is a pretty important concept, but you got to just kind of understand the reason why you have to send this blood to the liver. And it has to do with the fact that blood coming from your intestines and from your spleen has things that you don't want to just send throughout the rest of the body. So you got to send it to the liver. And then from the liver, notice, the blood leaves the liver in the hepatic veins, which then go to the inferior vena cava. So make sure you make a point of knowing the difference between the hepatic veins and the hepatic portal vein. All right. Then don't forget you've got a hepatic artery, because this is all deoxygenated. That liver needs to get a hepatic artery. All right. So the liver actually gets two kinds of blood: the oxygenated blood from the hepatic artery and the deoxygenated nutrient-rich blood from the hepatic portal vein. And then one type of vein that leaves the liver are the hepatic veins that are deoxygenated and have the right amount of nutrients. Okay? So that's the hepatic portal system. Last thing, and then don't forget, I'm sorry, you got to remove bilirubin so it goes from the spleen to the liver. All right, so the last veins we're going to learn here are the veins of the leg. So just like we did the arm, we're going up the leg. So there are anterior and posterior tibial veins that lie next to the arteries. There's fibular veins that lie next to the artery. There's a popliteal vein that lies next to the artery. There's femoral vein that lies next to the artery. The superficial veins we're adding to this are the saphenous veins. So there's one called the great saphenous, which is a very long vein. It's the longest vein in the body because it kind of starts down here at the inner ankle and goes all the way up the leg and thigh and then merges in right before they all become that external iliac vein. So that's known as the great saphenous vein. There's also a small saphenous vein, which kind of originates on the outside part of your ankle, but it dumps in at the popliteal vein. So it merges in with the popliteal vein. So it's a little bit shorter or smaller than the great saphenous vein. So all these veins of the leg eventually are merging together to form the external iliac, then the common iliac, and then the two common iliac veins merge together to form the inferior vena cava. All right, so those are veins. We might as well add our next kind of special circulation here on this video. It's called fetal circulation. So the reason why we learn this is we need to understand how that fetus is going to get oxygen and nutrients, because it's not breathing and it's not ingesting food. So how does a fetus get oxygenated, nutrient-rich blood? Well, the answer is the placenta. All right, so the placenta is an organ. It's made up of both mom's tissues, all right, and the fetal tissue. So it's kind of a shared organ. It's got a lot of blood vessels. It's got a lot of capillaries. It's got fetal capillaries. It's got maternal capillaries. And those capillaries don't allow the blood to mix together, but it allows things to get exchanged. All right, so the placenta is where things from mom's circulation can get into the fetal circulation, and things from the fetal circulation can get into the maternal or mom's circulation. So from the placenta, we have an umbilical cord, which attaches to the fetus. And within that umbilical cord, there's blood vessels. All right, so we're going to learn the blood vessels of the umbilical cord. We're going to first start off with the umbilical vein. All right, so inside this placenta, let's imagine the fetal blood obtains oxygen and nutrients. All right, so from that placenta, we want that blood to flow towards the fetus. That blood is flowing towards the fetus in what's called the umbilical vein. All right, so that's this large vein here. Notice it's blue, or it's red, so it's oxygenated, right? So the blood capillaries picked up mom's oxygen and nutrients. We're going towards the fetal heart, so it's a vein. So this is the second vein we've learned that's oxygenated. We learned the pulmonary veins are oxygenated, and so is the umbilical vein. That vein is going to enter the fetus. All right, this is the little umbilicus, or the belly button. That umbilical vein is going to now be in the fetus. It travels through the liver, where it has a different name, the ductus venosus. We don't need to worry about that, but it then attaches to the inferior vena cava. So that's a problem, right? Here's the inferior vena cava of the fetus. Well, now all of a sudden it gets some oxygen. All right. The problem is that blood is entering the wrong side of the heart. We want oxygenated blood on the left side of the heart, but it's entering on the right side of the heart. All right. So in order to get some of that oxygen, that oxygenated blood, over to the left side, there's a small little hole in what's called the interatrial septum. This is the septum in between the two atria. That hole is called the foramen ovale, if you remember that from the heart chapter. So now we get a little bit of this oxygenated blood over to the left side, and now we're good. Now we can pump that blood throughout the fetus. Notice they use this purple color. Purple kind of represents that it's not fully oxygenated, like an adult oxygenated blood. Because you've mixed it together with deoxygenated blood, it lowers some of the oxygen levels. But that's okay, because a fetus doesn't need the high oxygen like, we do once we're born and once we're moving around and once we're, a child or an adult. So a fetus doesn't need as much oxygen. So from there, right, we can pump this semi-oxygenated blood throughout the body. Notice that this also shows the little ductus arteriosus. So at the same time, since the lungs aren't oxygenating, notice these pulmonary veins are not oxygenated blood, we can do a shunt. So we can send some of this blood that's traveling in the pulmonary trunk, instead of sending it all to the lungs, we can shunt it over into the aorta. So then after birth, this hole needs to close, right, and become a fossa, and then this ductus arteriosus has to close and it becomes a ligament. All right, so now we gotta send blood back to the placenta. So that blood is going to go systemically. So in the fetus, it's going to go left atrium, left ventricle, aorta, right? It's going to come down the aorta, and it's going everywhere. But then what we want to do is figure out a way to send some blood back, all right? Because we got to complete the circuit. And we send blood back by bringing arteries off of the fetal internal iliac arteries. So here's the fetal internal iliacs. Coming off of those internal iliacs are the umbilical arteries, which, since there's two internal iliacs, there's two umbilical arteries. And those umbilical arteries travel the rest of the way back to the placenta. All right? So what do you need to know? You need to know what an umbilical vein is. So what kind of blood? Where does it come from? Where is it going? So it's oxygenated blood coming from the placenta going towards the fetus. And then understand the umbilical arteries. There's two of those. that come from the umbilical or from the fetal internal iliacs back towards the placenta. All right, and that's how you complete the circuit. All right, so that is fetal circulation. This ends the anatomy portion of blood vessels. So I would work on that and then start the physiological videos once you've started to work on the blood vessels. All right. So this next video is going to start the physiology.